No, teachers training is available for all those who have applied for the teacher's post.
Okay, sir. Thank you, sir.
No, teachers training is available. Yes, friends, welcome to our 22nd episode of Acu-Talk. And we are continuing with the series of the five elements. The five elements are the heart of acupuncture philosophy. And it is very important that all acupuncturists must understand the five elements to give good results according to the acupuncture theory. Sometimes when we ask the question, what are the five elements? We find that many students and many acupuncture practitioners also cannot give a appropriate answer. So let us begin by revising that concept and then try to understand what is the wood element all about. We all know that the acupuncture philosophy, it has its base or foundation on vital energy, chi, prana, etc. That is the concept. It is the concept which also means that we are energy. We are not just flesh and bones. We are energy, and on our energy framework, our body is arranged. Okay, so it is not the reverse thing that we have our nervous system or the circulatory system and chi flows through that. That is not correct. We have our energy system, and that energy framework allows our body to be formed onto it. That is one basic fundamental that you must all remember. And it is the flow of this energy which determines your consciousness, your intelligence, your health, your strength, etc. Now, this energy or chi, it is further refined, further, I would say, translated into different energy components or functional components. So we have, say, the big umbrella of energy, and under which various different energies form. Just like we have sunlight, but different things on earth, they absorb the sunlight and then they use it for specific functions. So similarly, the chi or the energy is transformed into many, many components. Now, this transformation into different end products, okay, it goes through five phases. So from start till the end, the transformation of chi from its raw material to its finished product, it goes through five phases. And these are the five phases that are the five elements. So the five elements are nothing but the phases of transformation of chi. So when we talk about the names of the five elements: the wood, the fire, the earth, the metal, and the water. We are not talking about the physical entity that we connect to. So, wood is not about the tree, or fire is not about the flame, earth is not about the mud or the soil, or metal is not about any hard substance, and water is not actual water. That is a symbol. It represents a kind of a co-relationship to the process, to the transformation quality. Okay. Now, when you study the textbooks, you will be given an example of a seed. And then the seed, when it ultimately becomes a tree, bears the fruits, and then it sort of finishes its life cycle. Similarly, the chi goes through these five phases, from germination till the fruits and till its repeat life cycle. Okay. So let us connect to this particular concept. For all practical purposes, I always state that the cycle begins from, okay, let me see who gives the right answer. I want all of you, any of you, punch in your answer. Where does the five element cycle begin? Which is the first element? Come on, let us see how many answers I am getting. Okay, so our replies are water, kidney, wood, earth, dryness, water, water, wood, wind. All right. Well, at least we have a limitation in the answers. Okay. All right. So, as per philosophy, the birth and death are at the same point, and that is water. Water is the beginning and water is the end, because water is cold, beginning is cold, and the end is also cold. Okay. But that is the philosophy. But when you talk about life, life is like germination, and it is like the sprout that comes out of the seed. That is the first sign of life, and that begins with food. So both answers have their unique value and validation, that water to water is the universal cycle, but the life cycle, it begins with wood. So today we are not going to study this wood element as a, I would say, a regular way of studying, that, okay, wood element is connected to liver, bladder, these are its functions, and it distributes chi, etc., etc. Today we will study it in a different way, and I want all of you to study elements in this pattern. So let's begin our sharing and understand the real way of understanding the wood element. All right. So here we are, the wood element, understanding the energetics of elements in acupuncture. So this is very, very important for us. So the first slide itself is very important. We have to understand the philosophy. Now, please understand this very, very carefully. The wood phase is marked by the smooth process of becoming, like the first green sprouts bursting above the soil's grasp, or the wayward weed miraculously whirling its tender face through the cracks in the sidewalk. Wood is the energy of germination. Wood is the energy of birth. Wood is the energy of arousal. Wood is the energy of creativity, imagination, passion, growth, determination, and hope. Wood is that which propels all life forms into the active manifestation of their authentic nature and destiny. So, this is philosophy. So, what comes to your mind? Okay, now let us correlate this clinically. Sometimes we find that we get patients with azoospermia, or we get patients, I'm talking about fertility issues because that was recently handled by me. So the husband doesn't have sperms, okay? So the report shows azoospermia. That means the very germination of the sperms has not happened. If the sperms are less in quantity, it would mean something else. If they are not of good strength, it would mean something else. But if they are not there, that means the wood, the spark is not there, and the sperms are not able to manifest. They are not able to germinate. And that is where the wood element would come into the picture. It would actually allow the sprouting, the germination, and the growth. Okay, so that is how you must correlate the philosophy of the wood element. So, the next slide, the wood within us. We all know that the wood element is liver and gallbladder, but let us understand this a bit better. While the liver is like a general, okay, when you have a king, queen, the kingdom, the army, you have a general. So it is like a general, or it's like an architect. So what does a general do, or what does an architect do? They strategize and initiating the equitable distribution of resources and smooth operation of being. So we have in our textbooks that the liver, chi, it is responsible for even distribution of chi all over. So when we have uneven distribution of chi, we use the wood. So in this language, when you correlate it as a general or an architect, the words used are strategy, equitable distribution for smooth operation, and the gallbladder carries the liver's plan of action. That means the liver plans and the gallbladder implements. All right. So the wise decision making. So people who cannot make decisions in their life, who are always confused. And this is an aspect which you must look for in your patients. If the patients cannot decide, they are confused. What should I do? Should I start the treatment? Should I not start the treatment? I have sometimes, selected wood just on the basis of the, I would say, confusion of the patient who cannot decide when to start the treatment. Shall I start? Shall I not start? They are confused. And when we give the gallbladder points, then they are very sure, okay, now I am convinced, let me start the treatment. So, clear vision is the liver's mission. Okay, so the liver can give you a vision The gallbladder will help you make the right choices for the vision. So this is very, very important to understand about the wood element. Let us go to the next slide. Wood in our body. If you look at the picture, a rectangular face, wide shoulders, and energy in brows, nose, and chin. So you will actually see a rectangular face, that inverted triangle. So the patient will look like this. It will look like a V shape, like a He-Man or a She-Woman, but broad shoulders and narrow, slim waist, etc. And the energies are in the brow, nose, and chin. So their nose, chin, everything is very, very prominent. Look in the mirror, see how your nose is, how your chin is. You will understand which element is active. So, what does the wood in our body do? In the body, wood mediates the storage, detoxification, and circulation of blood, flexibility and strength of connective tissue, that is, tendons and ligaments, vitality of the eyes, healthy digestion of fats, and balance and coordination. Now, if you know these functions, you will understand wood and its clinical application. Somebody losing balance, like vertigo, okay, feeling giddy, they cannot coordinate, things fall from their hands, they fall very often. You must always think about balancing the wood element. So look at these points again. Storage, detoxification, and circulation of blood. So menses or anemia in a way, because kidney and wood together are responsible for it. Connective tissue, our tendons, ligaments. Wood is tendon and ligament. Earth is muscle. Always understand the difference. Vitality of the eyes. The eyes of a wood person are always shining if they are healthy. If they are not, they'll become dull. They can develop cataract. Ability to digest fats. Now, this is what I love. You can eat all the pav vada, all the chips, all the oily food of India, and you will be able to digest them. All you have to do is stimulate your gallbladder and liver points, and you are happy. You will not put on weight. That is what you can do. And lastly is the balance and coordination. Expressions of wood. Understand this now. We always have read that wood is associated with anger. That is not 100% correct. You must understand what is the wood anger. Okay, so this slide explains the wood anger. In health, the emotion of wood expresses as an easy, unforced clarity of direction and action. That means there is a vision, there is clarity, a vitality of imagination, and certainty of vision. So the person is very clear. Out of balance, this manifests as outright irritability and aggression. That means if clarity is missing, if you don't know what you're doing, then there is irritability and aggression, but also shows up as timidity. The person is very shy, timid, cannot speak, cannot talk about one's needs, cannot make a clear decision, or cannot decide about the life's plans. Then also wood is coming into the picture. It's not only anger, irritability, and aggression. The opposite side is also in the wood framework. So understand this. There is a, what we can say as, lack of clarity, lack of direction. That is what is giving irritability and aggression. It is not only anger that, okay, I become angry and my wood element is disturbed. No, you are becoming angry because there is lack of direction in your life. So sometimes it makes sense to talk to your patients, talk to them what is going on in your life, what are you doing. And you may find that whenever they are at a crossroad, they cannot decide, they have a important decision to make, a choice to make, whether to go here or to go there. And that is when they fall sick. That is because the wood element is getting depleted because of the choices they have to make. And we come on to now the actual signs and symptoms based on whatever we have understood in the last few slides. Let us understand some key points. We all know the wood element is associated with liver and gallbladder. When wood is unbalanced, you may experience symptoms such as feeling irritable or angry. But in a common day-to-day practice, you will see headaches, migraine, high BP. These are the signs of liver yang rising upward. So, liver yang rising is the most common syndrome that you will find. And what are the four other signs? Rib pain. Okay, so liver meridian runs along the rib area. Any stagnation of liver chi will be reflected in a distending discomfort around the ribs. Sometimes we see patients complaining of bloating. Upper abdomen gets bloated. Below the ribs, there is pressure. This is a disturbance of wood. It is commonly seen in stressed people. Then the next sign we have itchy and dry eyes. TCM believes that liver blood can travel upwards to nourish the eye, and deficiency in liver blood may lead to eye issues like floaters, myopia, sometimes bloodshot, red, and painful eyes. And I have also mentioned that it is also contributing to the formation of cataract in conjunction with the kidney. Spasms, whenever there are spasms, something becomes tight. Okay, we see patients who say that हमारे नस के ऊपर नस चढ़ गया, यानी you find that some tendon, some muscle suddenly becomes tight, especially the calves. Liver is the problem. And the reverse, loose muscles is earth, tight muscles is wood. Okay, so when you see a patient with spasms, always balance the wood element. You can use the wood point of a channel also, that will also work. In the yin channels, wood is the last or the first point, and in the yang channels, metal is the last or the first point. That is what you will have to know when you study more in detail. Okay. And as a rule, brittle nails. So if liver blood is deficient, you may have dry, brittle nails, ridges or spots on the nails. Doesn't this make your job very simple? When you understand this, when you understand the philosophy, okay, of the wood element, how it is about becoming, how a small weed grows in the sidewalk somewhere in the tiles. There is birth, arousal, creativity. Then the wood within us gives a clear vision. You can make choices and decisions. This is how it looks. Just by looking at a person, you can know what element is predominant in that person. Then the various expressions of the mind level, how the lack of clarity gives irritability and aggression. And lastly, some signs and symptoms which are easy to identify. This is the summary of understanding the wood element in a slightly different way. I'm sure many of you may have studied in this way, but give this more emphasis, and you will see that the results that you get in your practice are much, much superior than when you resort to custom formulas. The biggest problem that we find is people just want a fixed formula. They don't want to understand the patient. They look at the mobile internet, okay, for pain in the abdomen, which points, okay, the mobile will show you 5 points, they'll give the 5 points. There is no understanding of elements, the transformation. Where is the cycle stuck? Okay, we have five like stations, station one, two, three, four, five. The your train may be stuck at station one or station three or station four. You have to know that, and you have to decongest that station so that the transformation happens and the whole cycle gets completed. So this is the gist of the element theory, and this is the gist how you should understand the elements. We will try to elaborate on this tomorrow in our graphy session. We are holding a complimentary graphy session for all the graphy members. So all those who are on graphy can join in. We'll do a bit of an expansion of what we have discussed today. Uh, that is what we will be doing. All right. So now we are open for questions. Uh, all of you can unmute. Let me unmute you. All right, you can unmute yourselves. Whatever are the questions in your mind, you can ask. How did you like today's presentation and what are your queries? Come on, let me hear a few of you.
Sir, can you give some example of like transition? For example, if I am seeing anger in one patient, how with respect to the element like the mother son relation, or how do you differentiate? For example, which symptom, like a practical example where how will you differentiate which what you are tonifying and what you are that way, something like that. Like ये symptom है, but it clinically you will see it in some combinations.
All right. In fact, this is the explanation which I'm reserving for tomorrow's session.
Okay.
So tomorrow we will be touching this particular aspect, okay? But what I can, throw light upon is that in theory and in practice, there is a slight difference. In practice, the symptom is not only at a single point, okay? It
Exactly.
means that it is not only the wood that is disturbed and I'm treating wood. No, it doesn't work that way. You have to understand the wood element fine, but in practice, always look at an axis. Okay, the word is axis. So you can have wood and earth axis, you can have fire and metal axis, you can have water and fire axis, you can have metal and wood axis. So you will always find the symptoms on a axis.
So you mean to say two elements का symptoms साथ में होगा? That's what you're trying to say.
It may not be symptoms of two elements. The element will be one.
Okay.
Okay. But if you look at the chronology, then you will understand where it started and where it is ending.
Okay.
So that is what is most important in acupuncture, because sometimes in childhood, it would start as, the child is very shy, unable to express himself. And slowly, slowly, as he grows big, then suddenly you find that he is a very angry person, and he has bloodshot eyes, and maybe he resorts to violence. But the history will tell you that he was timid also. Then you will also find that he has indigestion, and he also has gastric issues, digestion issues, so that the liver earth axis is developing the disturbance. So you will always see this development, okay? Like the wood element is not a single fixed entity, it is a phase, it is a transformation. So something is happening, the germination is happening, the beginning of any process in your body, the formation, the birth of a new cell. Okay, sometimes even hair loss. You are losing hair, but new hair are not coming up. So you have to use liver sometimes. All right. So this is how you have to always understand that acupuncture needs the axis connection or circuits. Okay, these are the thing that you must keep in mind.
Sir, one question, please.
Yes,
Sir, gallbladder stone, how can we judge with this wood element
correct. So
balance?
you'll be very surprised to know that in fact all my patients with gallbladder, I
Yeah.
made I make them do what is known as anger purging. I make them throw out their anger by a special process which we call as the mind therapy. Okay.
Hmm.
As a rule, I have found that 90% of cases of gallbladder stone are
Hmm.
actually suppressed anger.
Suppressed anger. Yeah. Yeah.
Okay.
Okay.
So now the stone is something solid, correct?
Yes. Cholesterol, maybe.
That's
Yeah.
the most common, I would say, element or the content of the stone. Okay, you have calcium, cholesterol, or the combinations that
Yeah.
coagulate, and
That
then
report shows that LDL or something is more.
it may
Yeah.
show all that. So now hardening is a property of metal,
Metal. Okay.
correct? What is hard? Metal.
Yes.
So when you examine this person, look for the metal point on his wood channels, like
Yeah.
GB liver. Look out for the metal points and see if they are tender or not.
Metal point on wood channel. Correct.
Metal
Correct.
point on wood channel, check it.
Yes, sir. Got it. Got it.
That is how you have to develop your
Yes,
practice.
sir. Yes,
Very
sir.
few people do the physical checking. They don't understand that tenderness is a signal that the point is disturbed.
Yes.
And it will also show you the correct point.
Definitely, sir.
Okay, so this is how you must use your knowledge. All right. So when you are treating gallbladder, definitely you have to disperse the metal, you have to mobilize it. Okay, so that is how the stone also will get
I would
mobilized.
like to share my experience with my mother-in-law. She has
Hmm.
recently found 15 days back. She had bad with this gallbladder stone, sir.
Hmm.
And we contacted the surgeon. Then he told that it should like immediately removal of this gallbladder.
Correct.
But before that, what happened? She was just lying down in the bed for 3 days without anything eating, and she cannot express also what
Okay.
is going with her. So
Hmm.
I just, with my intuitions, I just did acupuncture on her,
Hmm.
and from next day onwards, she started eating and everything.
Hmm.
Like she was not eating also because
Hmm.
vomit was getting up. Like
Hmm. Hmm.
so, then I did sonography and everything. So then sonographic person told that photography person that that stone was stuck in the pipe. Okay, and very big stones are there, like 2.9 centimeter or something. But some stone must have stuck up there, and that's why she was vomiting. But when she has started eating like it is like the stone must have moved.
Okay.
So I feel myself lucky that I saved her or whatever.
Correct.
So I
So,
by
correct.
God's grace and you people mentor, like we are getting the correct knowledge. Thank you, sir.
Correct. So that was nice. And somebody has asked about phlegm in the GB. Yes. So that also is one of the, I would say, etiological factors of acupuncture, where there is phlegm as a concept. But when you have phlegm in the gallbladder, it will show as sludge. The sonography will show more of sludge, or it may show small stones. But if they are big stones, it is the hardness of metal. If they are small stones or sludge, then it is phlegm. So you have to differentiate. You have to understand that all five elements or all five phases can happen anywhere, and which is active, which is the most troublesome, you must handle it in that way. All right. And we are on our last question. Yes, Mr. Mohan, I understood your question and I hope I have given you a satisfactory answer. Okay, about the phlegm. Of course, phlegm you can correlate to the stickiness of fat, cholesterol, all that also. But combine your knowledge. If the person is having a fatty abdomen, a fatty liver, then that also must be considered, and then you can decide. All right.
Sir, one more question. D3 B12 deficiency, is it related to with wood element or some other?
Uh, that is not a very easy question to answer because
Actually,
it
supplements.
it can also be due to deficient absorption. Okay, if your
Yeah, because blood
digestion
related, that's why.
digestion is disturbed, your absorption, assimilation is disturbed, that also can be the cause.
Hmm.
Or there is a, I would say, a damage. Sometimes the vitamins B, D, they are actually destroyed in the body by toxic substances.
Hmm.
Then the liver comes into the picture because liver can remove the toxins. Okay, and
Yes.
specifically the refined oils. I have told this many times. When you consume refined oil at home, that refined oil is going inside and it is damaging your vitamins, and that is how you become deficient. Stop using refined oil.
But then which oil to use, sir?
You must use ghani ka tel. That is safe, absolutely healthy. Okay. Hath ghani ka tel,
Kachi
fresh
ghani.
extracted oil, organic oil. It is
Okay.
available in the market. Ghani ka tel. Please use that.
Okay, sir. Thank you.
Sir,
Okay.
sir, one
Last
question, please.
last
Sir,
question. Yeah.
sir, I just wanted to know about the lipomas. Are they also related to wood elements, sir?
Okay. Lipoma is a very common occurrence and they are technically fats. Okay. Lipids are
Mm-hmm.
coagulated and deposited below the skin.
Hmm.
Yes, you can look at the wood earth axis.
Okay.
So
Okay, sir.
I would attribute lipoma more to earth disturbance than the wood disturbance,
Okay, sir.
because
Okay,
that
sir.
is the actual phlegm, hardened phlegm. All
Hmm.
right.
Hmm. Okay, sir. Okay. Thank you very much, sir.
All right. So let me summarize. Uh, okay, there are a lot of questions coming up. Quickly, let me summarize. Chronology is very important. You will know the development of the symptoms, where it started, where it is heading. It will help you identify axis. It is very important. And confusion to take decision due to fear and memory issue to remember. Okay. So fear doesn't mean that you are not taking a decision. Fear means you are not implementing your decision. You are afraid to implement, but in your mind, there is a decision. Okay. So fear is attributed more to the kidney element, water element. And loss of memory and all that also doesn't mean that you are not deciding. What is relevant here is that you are confused. Should I do this or this or this? You don't know what to do. I don't know. I am confused. I am lost. That is wood and gallbladder. Okay. So, friends, with this, I conclude today's session. Hope you have all enjoyed it. And tomorrow we will expand on this on Graphy. We are holding a kind of a trial session. All members, please log in with your Graphy account. See you tomorrow. Thank you very